Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Indications of surgical management in vesicoureteric reflux. In vesicoureteric reflux, surgical management is indicated if the child has breakthrough urinary tract infections even after giving prophylactic antibiotics. If the child develops urinary tract infections even after prophylactic antibiotics, then we can give surgical management. For severe grades of reflux like grade 5 reflux or bilateral grade 4 reflux, in these severe grades of reflux, surgical management is indicated. If the child has any new scars or if there is deterioration of the renal function is seen, has on serial ultrasonography of dimercaptosuccinic acid scan, that is, if you see presence of new scars or deterioration of the renal function, in such cases the uh, surgical management is indicated. If there is reflux is present or if reflux persists in girls, if there is reflex, if it persists in girls at puberty, even then we indicate the vesicoureteric reflex. If the reflex is associated with congenital anomalies like bladder diverticula, then it is better to first correct the congenital anomalies so that the reflex will not recur back. Then, if in any cases of secondary reflex, in secondary reflex, we will have to first treat the cause of the reflex, and then all secondary reflexes will persist after the correction of primary cause. So in such cases, if there is posterior urethral reflexes, we should first remove the posterior urethral reflex, in posterior urethral valves resulting in reflex, first we should remove these posterior urethral valves, only then the reflex will decrease. So only and only we should first correct the primary condition before we treat the secondary reflexes. So we should correct the primary cause like this, and then we should do the surgical management for vesicoureteric reflex. Okay. In vesicoureteric reflex, the one liner is urinary tract infection is the most common cause for scarring and nephropathy in patients with vesicoureteric reflex. In patients with vesicoureteric reflex, urinary tract infection is the most common cause for scarring and nephropathy. But this is not the only cause. Scarring can occur even in the absence of urinary tract infection. Even without any urinary tract infection also, scarring can occur due to the presence of the reflex. Due to presence of the reflex on renal tissue, also scarring can occur, because it's simple. Here there is a ureter and this is the bladder. Whenever the reflex occurs into the ureter, these reflexes will reach the pelvis and the calyces. So the reflex is nothing but the fluid, so this fluid will pose pressure over the renal cortex. So because the fluid is putting pressure over the renal cortex, this can cause scarring of the renal cortex, resulting in uh, scarring.
thank you and thank you for watching.